Welcome back, everybody. Our next speaker is Joe Bauer, Child Life Specialist at Walter Reed National Military Medical Center, who has worked with pediatric patients for the past 12 years. In his work with patients and siblings specifically impacted by pediatric cancer, Joe uses play to both normalize the hospital and to process feelings related to treatment. As an advocate for play as a tool to manage the effects of trauma, Joe promotes play within the classroom to lessen the stress of school reentry after an extended absence. Welcome, Joe.
Hi, everybody. I'm so happy to be with everybody today, and thank you so much, Susan, for that warm introduction. Before diving in, I just wanted to, briefly kind of touch upon what Susan already mentioned. So, as a certified child life specialist, I'm, providing a ton of normalization in the hospital through therapeutic play opportunities. I'm using different modalities of play to employ distraction techniques during tests and procedures. I'm providing developmentally appropriate education to patients and siblings and just general emotional support for families affected by cancer. And like Susan mentioned, my support, specifically for kids getting back to school is really, really rewarding to me. And I love to be impactful for these patients. So our objective today is to outline the significance of play in human development, to describe the psychosocial vulnerabilities of children undergoing treatment for cancer, to highlight the importance of play for children in the hospital, and to underscore approaches and resources to support patients, siblings, and their classmates. And so while we all know what play is and we see it every day of our lives, I just wanted to give a kind of a formal definition of both play and therapeutic play to give us a theoretical framework and how play specifically benefits kids with cancer. So quick definition of play is any activity in which children spontaneously engage and find pleasurable. So the key word there is spontaneous. So kids are going to play regardless of the resources that they have. Kids will play with whatever they have. It doesn't necessarily have to be toys. And there's an innate desire in every human to play. So quick definition of therapeutic play within the context of the hospital is a framework of activities taking the psychosocial and cognitive development of children into account in order to facilitate the emotional and well-being of hospitalized children. So just of note, so play therapy and therapeutic play often get used interchangeably. But however, we're not going to be talking about play therapy today, as that is a separate discipline that's carried out by a registered play therapist and is used to address a wide range of behavioral and emotional issues that may not necessarily stem from any medical trauma. So what are some of the specific reasons that kids need to play? Well, on a surface level, kids need to play because it's fun, it's amusing, it's enjoyable, it creates bonds between people. But in a more theoretical sense, it's how young children from infancy on, they learn about the world. It shapes their thinking and is the easiest way for them to acquire knowledge at a young age. So play promotes all aspects of development in the areas of language, cognition, social emotional skills, motor skills, and self-regulation skills. Play cultivates key executive functioning skills like planning, organization, flexibility, and attentiveness, which are all integral components when adjusting to adulthood. And one of the best things about play that I love is how it's a universal way of connecting with others, regardless of cultural status and socioeconomic status. And we see the greatest evidence of that in young kids. And from a detachment perspective, play with parents or other caregivers establishes a child's ability to build trusting and nurturing relationships that will determine their capacity to do so as adults as well. So now that we've outlined the foundation of why children need to play, I just want to shift briefly to focus on the perspective of the child in those first few days that they're diagnosed with cancer and how their ability to play is impacted. So I'm not going to spend too much time at all on the medical aspect of things, but I think it's just important to briefly describe kind of what those first few days of the treatment journey looks like. So typically, but not always the case, families will bring their child into the emergency room when there's a suspicion that something more serious is going on. And in the emergency room, that's when kids will always be given some sort of IV access, which will run their blood work. And that's going to be the first medical intervention in a long line of procedures that may cause significant fear and distress in young patients. So these potentially invasive tests and procedures that then follow, many of which children are NPO or have to wait hours before eating and drinking, They're all performed to gather the right imaging and tissue sampling to confirm a diagnosis. And once a diagnosis of cancer is confirmed, it still might unfortunately take several days or even weeks before an exact name is given to the type of cancer. So with or without a definitive name, the next step is for a central line to be placed, which is a special catheter that I'm sure has been mentioned at some point today, that is used to give chemo for the extent of their treatments. And once this catheter is in place, treatment will begin, and each plan will be individualized and prescribed to each patient. So for kids going through this very harrowing experience, multiple different facets of it can be traumatizing for kids. And for most of these kids that are diagnosed, this experience of staying in the hospital is completely new to them. They are feeling completely overwhelmed with what's happening to both their bodies and overwhelmed with the information that's being thrown at them. So for all kids going through this ordeal, there's a degree of personal agency that's always taken away. They're feel completely stuck and they can't engage in the same activities or assert the same control over their day-to-day lives. And this really is its own form of grief since their life has been altered in such a profound way. So during this time that they're in the hospital, they're probably spending a ton of more time with their parents than is typical, and everyone's emotions are all over the place and feeding off one another. So for a lot of these kids, usually school-age patients, cancer has a really daunting connotation to it. Many have had older family members or someone that they know has been diagnosed with an extremely debilitating and had an extremely debilitating treatment battle. And for a lot of these kids that I work with, it takes some major reframing of that word cancer, where we stress that cancer in kids and cancer in adults is very, very different. And we're always going to want to let them know, depending on the developmental level, that nothing that they did or anyone did caused this. It just is something that happened. So when we're categorizing play within the hospital, it shouldn't be seen simply as a recreational activity, but always carries with it a therapeutic purpose. Activities are going to be pre-planned in an organized fashion with both individual and group-based goals. And these goals are always established through an assessment process that I'm always carrying out with every family that I'm meeting. And one example of a goal that I may devise with the patient is to encourage more interactions between that patient and the staff members like nurses or doctors that are taking care of them. And another goal might be to maybe schedule video gaming sessions between that patient and two or more teenage patients. So despite play being the foundation of childhood, kids in the hospital with a new diagnosis, they oftentimes need prompting by people like me to get back to playing and participating in structured activities based on the traumatic nature of the hospital. So it can really dampen a kid's desire to participate in the activities they otherwise find enjoyable, and it becomes my main focus to address this lack of engagement. So within this discipline of therapeutic play that I outlined earlier, 3 subtypes exist. And the first is play that encourages emotional expression. That can be any form of imaginary play, where I'm trying to uncover how a patient feels about a particular subject or experience. This may involve something like using dolls in a dollhouse to invoke how the child is feeling about the relationship between them and their siblings. So the next form is instructional play that's used to educate children. So an example of that is maybe using stuffed animals to reenact a treatment experience that occurred earlier during an admission. And then finally, physiologically enhancing play is using various activities to motivate the patient to engage in physical tasks that will improve their wellness. So one really cool aspect of play is that I always undertake with patients is called medical play, and it can fall into those first 2 categories I described. So it's a strategy that's used by child life specialists to educate on treatment and to elicit feelings related to a part of treatment that may be causing the child to feel scared or anxious. So real medical supplies are used in this context, of course, in a safe manner. And usually a doll or a stuffed animal will be introduced to that child to act as the patient. And that child is encouraged to assume a role as a doctor or nurse. And during this experience, as I'm by their side, I'll be there to both ask prompting questions, but I may also be assigned by the kid to maybe be another doctor or a nurse or some other job within the hospital. So some of the prompting questions I may ask is, tell me about this that you're using, or how is this equipment used to help your patient? So a key part of this should be to encourage kids to make real world connections between their play and their own healthcare experience. So of course, when any kids are in the hospital, there's a lot of barriers that exist, and it's a high priority for child life specialists and other team members to address these issues and then make accommodations. So it goes without saying that kids are going to have limited play opportunities, but it requires an approach by the team within pediatrics to treat play as a standard of care. And this is reflected by literature and publications within the American Academy of Pediatrics. So being isolated in the room, maybe for something infectious or for mobility issues, can be really difficult, especially on young kids. So we try to facilitate as many bedside activities as possible. So when kids are having low activity levels, a child life specialist may actually play for the patient and engage in adaptive play, where that patient, unfortunately, is really only able to watch play because of their medical condition. But within that context of play, we would maximize the degree of choices that that child has, maybe by nodding their head or shaking their head to being given a lot of different choices within that play. So social or group play can be really difficult to coordinate when any patients with cancer are in the hospital. So it becomes a big priority to connect patients maybe through special events like holiday parties, bingo in the playroom, or for young kids, maybe toddler circle time. So it goes without saying that treatment in the hospital is always going to conflict with play. But to address that, we often make schedules or we readjust our time for play opportunities by being really flexible. And there's a lot of times a decrease in motivation for kids that are admitted with cancer. So with that, we'll design incentives like sticker charts, maybe dollar systems that can be effective in getting some kids back on track. So now I want to shift to highlight the specific benefits of play for young children that are diagnosed with cancer while they're in the hospital. So first off, play makes kids more familiar with the experience of being hospitalized. When kids are able to play during their stay, they can naturally explore their environments in a way that would be more difficult if they refrained from those normal activities. It allows them to better interpret everything in their hospital experience, and having play interspersed between and during medical interventions helps them better relate to what they're seeing and hearing. So maybe that's something simple like playing Uno right before a CT scan or putting Band-Aids on their stuffed teddy bear after an IV is placed. So secondly, play allows kids to be active participants in their care. As I said earlier, so much control has been taken away, and engaging in play where maximum choices are offered has enormous benefit to their confidence and resiliency. Really, all kids love choices, but especially kids in the hospital. When kids play with even one medical staff member, like a doctor, nurse, or even a child life specialist, it's going to improve all staff relationships across the board and will usually make the patient put more trust in everyone involved in their care. The play in the hospital is used to teach kids about their treatment, whether it be standard imaginary play or the specific type of medical play with real materials I described earlier. And this really is the bread and butter of what I do as a child life specialist. Every day, I'm using play opportunities to narrow a kid's gap in understanding about their own healthcare. My approach will usually involve equipping any play spaces with as many medical-centric toys as I can, like doctor kits or other toys, to help egg children on to learn more about their treatments and any treatments in the future. So one really rewarding thing for me in my job is that I can usually build rapport pretty quickly because my approach is rooted in play and engaging them in what they enjoy. For a lot of these kids, they connect best with people whose agenda is rooted in just promoting what's familiar to them. When they're engaging in stuff that puts them at ease, whether it's in the playroom or playing at the bedside, then they'll be willing to discuss heavy topics and open up about treatment-related things. So during play every day when I'm in the hospital with kids, they're making symbolic associations between their treatment and seemingly unrelated objects. An example might be a kiddo is playing with a race car track and maybe they're pushing a car through a tunnel and say, hey, that looks a lot like the tunnel that I saw during my MRI. And then for this kid, making that association may lead to a larger conversation about how they're coping with treatment. Next is play reduces regression. So beyond the physical regression, kids with cancer can also show regression in social and emotional ways, such as patterns of attachments, social withdrawal from peers, and difficulty regulating emotions. So with this, kids' brains don't have the same capacity to flourish as they do under normal circumstances. But when they're consistently playing, their minds are challenged to stay on track into reaching developmental milestones. And this is especially important in children under 2. It becomes so important for staff like me within the hospital to collaborate with those parents to stay the course and hit those key milestones in those first 2 years. So play also encourages the strengthening of bonds between family members, which is maybe as important as ever when their child is diagnosed with cancer. So some common feedback that I've received over the years is that the helplessness that many parents describe when their kid is stuck in the hospital, it can be alleviated when they just simply see them act like a kid. Just seeing them engage in small bouts of playtime will give some reassurance that their child, who has had so much taken away with this experience, is still able to do many of the things that bring them joy. So any play opportunities should really prompt parents or other caregivers to engage and play with their kids as much as possible. I can only do so much as a child life specialist, and many parents that I work with, they really need that extra push to put aside their own stress and get back to the basics of engaging their kids in playtime. And of course, play should also include siblings as much as possible. So for brothers and sisters that have someone in the hospital that's a sibling that's sick, they really need to see that sibling just playing with something that they enjoy for their own coping. So kids really have an amazing ability to refocus their attention during painful episodes. Distraction using play is something that I do every day in my job when kids are going through something tough and invasive, maybe like a vaccination. And there's a really cool and impressive body of research that's a presentation in its own about virtual reality gaming and its role in reducing pain and anxiety during procedures. So for older school-age patients and teenagers, many hospitals have started to use this technology to distract kids during painful procedures. And when I've seen it, it's just really cool to see their ability to divert a kid's attention and allow them to cope successfully for a procedure that otherwise caused distress. So like I said before, emotions for kids and their parents can really, be difficult to describe in conversation. And specifically for kids, play is a safe venue to explore feelings that may be too hard for that child to articulate. Play is maybe the most familiar format for them to reveal and process any traumatic events that may be normally viewed by the child as too dangerous to talk through a normal conversation. So imaginary play can be especially powerful in providing children what we would call a transitional space that blends their free-flowing minds with the external world where the trauma occupies. And in a safe space like the playroom, kids can create scenarios with different endings that are related to the specific care that they've endured. And then they will be able to process this with a trusted professional or caregiver. So now that we've discussed the value of play and we've highlighted how it's incorporated into the hospital experience for patients with cancer, I just wanted to transition now into what can be done by school personnel specifically through play and other means to support patients and their families facing a cancer diagnosis. So I'm sure it's been touched upon already today that the best approach to supporting a student with cancer who's missing any significant time in school is an approach that uses collaboration and expertise from all relevant staff in the school and staff within the hospital coordinating with one another. And obviously the parents are going to be central to that. They're going to be ones kind of guiding the ship with help from all people involved. So the length of absence, the period of absenteeism can really vary between patient to patient pretty drastically. Some patients, most prominently those with the more common types of leukemia like ALL, will generally be out of school for at least 6 months. But there are some diagnoses like certain brain tumors that may only cause the patients to be out of school for a few weeks initially. So during this long absence, like I said, a multidisciplinary approach, like I mentioned, is the best way to ensure that the patient and family feel supported on multiple levels. Roping in any counselors, school psychologists, social workers to assist the family, and especially the sibling during that absence, while the brother and sister getting treatment will ensure their emotional well-being is also being addressed. So I hope today that everybody has learned a lot about pediatric cancer. But if you are in need of additional knowledge or support when faced with this situation, definitely don't hesitate to reach out to available staff that work in your local hospital for advice, guidance, or in-person support. So a lot of child life programs specifically do a lot of community outreach, and there's a lot of professionals that are available to help guide you and support you guys in the classroom. So these staff members work with cancer patients every day, so they'll be very well versed in how to talk to kids about cancer treatment. So when I'm talking to a class or any group of students or just group of kids in general, there's a few basic talking points that I'm always going to focus on for kids who may only have a very basic idea with what cancer is. So I always want to convey that the student didn't catch cancer. I kind of always make the analogy of like cancer is like a broken arm. You don't catch it. It doesn't get passed to one another. Another is that pediatric cancer is very rare. We always want to make kids know, especially really young kids, that you're talking about this very scary experience, and you don't want other students thinking like, "Oh, I'm gonna get cancer next week." Um, I don't know the exact data on how many cases there are in the United States a year. Really, only a few thousand, so it is very, very rare. You always want to also convey that nothing predictable caused this. There's nothing that could be done to prevent this. And I think it's important too to convey to the class that anything and everything is being done to help the patients and that doctors expect a cure. We don't know what the future holds, but I think good language to use is that the doctors, in the vast majority of cases, they expect a cure. So for any student that's gone, there's some simple measures and gestures to help maintain connection. I always love it when classes prepare care packages for a student that's in the hospital. Signs or cards from the class to hang in their hospital room. Or I know that there's been a lot of cases in kids I've worked with where efforts are made by the school staff to encourage small scale attendance to school for brief periods before full-blown reentry. Maybe it's going to lunch with peers. Maybe it's attending recess or a half day. So I think that there's some different things that schools can accommodate patients with before a full-blown return. So now the programming and resources that Ask provides to patients and families and educators is amazing and really second to none. But I just wanted to do a quick shout out to three other organizations that also provide great and unique resources to schools with a student in the middle of treatment. And you may already know of some of these resources, and they may have actually been discussed today, but just wanted to reiterate how great they are in supporting educators. So I'm only going to briefly mention details, but if you want more info on these, there's a QR code at the bottom of the next 3 slides that will link to their website. So Monkey in My Chair is a really cute program that was established through the Love Chloe Foundation. And how it works is that the patient and the class are each provided a stuffed monkey. And in the absence of the patient with cancer in school, the monkey kind of takes their place and is taken to various locations around the school, like maybe to lunch and to the library, and then it will kind of just sit in that in that patient's desk when that patient is absent. So it's provided at no cost to families, and even contains an online component with what they call a monkey message portal, where pictures and other documents can be shared between the patient and their peers. So another great organization, which I'm sure many of you have heard of, is the Livestrong Foundation, which has been providing resources to families for decades. They have a great collection of activities and supportive content for teachers to educate their students on cancer in a developmentally appropriate way. And it's even organized into lesson plans for all grades and is intended to empower teachers to have open and honest discussions. And then I know that most of you know about HopeCam. So it's a great resource that can assist schools in maintaining connectivity through technology. And they're great and really flexible. And they focus a lot on kind of just the social inclusion of hospitalized patients and things. And the emphasis, is a little bit on the academics, but it's really mostly on remaining socially connected. So some of you may be aware of that there's a ton of great children's books about cancer. So the field of children's literature is really kind of taken off with addressing a lot of specific diagnoses and even some specific issues like hair loss. And some books will describe why patients with cancer lose their hair. So there's just 5 that are pictured here in this slide, but if you're on Amazon or Google, there are dozens that will be applicable to your classroom. So I want to talk a little bit about the experience of siblings that have a brother or sister undergoing treatment. So from the moment that their brother or sister are diagnosed, the dynamics shift dramatically within the family. So one or both parent is constantly at the hospital initially, with the siblings staying with grandparents, maybe family friends, and the messaging on what's going on always isn't great with siblings, and they lack a lot of key information those first few days. And this lack of information may cause them to create a false reality into what's happening. So once treatment is started and families get into somewhat of a routine, parents are constantly taking that sick child to appointments, and it becomes really common for a lot of complicated feelings to arise in siblings, like jealousy or maybe even guilt that their brother or sister is having to go through something so serious that they themselves don't have to endure. And so for any siblings, it's super important for any trusted adults in their lives, whether it's at school, elsewhere, to reiterate that any feelings that they're feeling are okay and normal to be experiencing. So within the school setting, ensuring that they have proper space and outlets to vocalize their worries and concerns is really important to their coping. But also for some siblings, maybe the best strategy is just kind of to let things be. Because for a lot of siblings, school can be a reprieve from all the hardship and abnormality they're experiencing. School may be one of the only stable things in their lives. And just kind of being on standby to monitor any behavioral changes is a great approach. You're going to take cues a lot of the times from parents that will allow the school to best understand what approach to take with each sibling. So also a lot of great resources for siblings that are out there, like the Leukemia Lymphoma Society. Alex's Lemonade Stand also has great specific resources on their website that are helpful in supporting siblings through their brother or sister's cancer journey. All right, so now the student undergoing treatment is a point where they're physically okay to attend school, and hopefully their reaction to returning is at all like this kid's excitement in the picture. But even with an excited student, there's a lot of nuts and bolts for the school to consider in a formalized reentry plan. So for most of these kids, returning to school can be the most significant way that they return to normalcy. A solid reentry plan should prioritize the emotional needs as much as the academic needs. So younger students, in my experience, will generally embrace some gestures to welcome them back. But I know that there's been some cases of kids that may want to treat their return as anticlimactic as possible. So just make sure you're, again, taking cues from the parents on the best approach in welcoming the student back those first few days. So typically developing children, young children have a really muddled sense in how illness impacts their childhood. So just even providing basic info to the class on the experience of their peer can be really beneficial. So we really want to make sure that we're communicating to other students when they return how their peer may be feeling overwhelmed or exhausted by answering so many questions. And one measure that can be taken to address any and all questions at once is an individualized back to school presentation that should hopefully be offered at most hospitals by child life specialists or other personnel. So this is a formal presentation with developmentally appropriate content that's either done shortly before return or sometime during the first week back. So child life specialists who perform these, usually hour-long presentations, they're uniquely positioned to provide an in-depth discussion on how their cancer was discovered, what happened during treatments, and why they lost their hair or experienced other symptoms. So it should be a really interactive discussion where open and honest answers are provided to help classmates better understand how cancer has specifically impacted their classmate. So speaking of being interactive, usually what I'll do and other child life specialists I've known will bring a few teaching aids to help just visualize different procedures or concepts such as hair loss. So there's only just 2 seen here. These are the most common ones that I've used to help mainly illustrate how chemotherapy is given. So the first is a chemo duck, and most large-scale hospitals should have access to both of these. So with a chemo duck, it's a tool that I often also use when conducting medical play with patients. And the Medican doll is a little bit more clinical, and it has an actual Metaport attached to it to help kids understand how chemotherapy is given. So these are just great hands-on resources that will be often brought into schools to give peers just a better conception of everything. So, and also during these presentations, typically I'll play one or two activities to provide hands-on teaching to classmates on the concept of cell growth and how normal cells turned into malignant ones. So the first one I've listed here, which I can't take credit for creating, it's done by a lot of child life specialists. It's called blood soup, and it's used to show how healthy cells got sick inside of the patient's bodies. So it specifically addresses leukemia. And really kind of how it works is that we use materials that are commonly familiar to children, usually things like candy or art supplies. I usually use candy, and what I use to symbolize the main three types of blood cells is for white blood cells, I use Tic Tacs. For red blood cells, I use hot tamales, and for platelets, I'll use lemon heads. So then usually you'll fill up a vat of water and dye it red to represent the blood, and then I'll have something else that represents malignant cells called blasts, and something else to represent chemo. And it's basically very interactive. Kids are throwing things in the vat of water, they're stirring it up. And within this activity, I'll provide narration to go over some teaching points about how blood cancer works. So the other one listed here is called Crazy Cells. So I developed it to help educate patients, specifically to educate peers of patients with bone cancers on what happened inside their body to develop a tumor. So how I do it is I ask everyone to gather in a semicircle, and I'll start to I'll do a semicircle to kind of mimic the shape of a bone. So let's say we have that patient developed a tumor on their tibia. So we'll kind of pretend that that semicircle is the bone, it's their tibia. And I'll throw a couple bouncy balls in at first, encourage kids to throw them to one another. It's going really well. But then I'll start to introduce more and more cells that kind of also it's supposed to kind of represent the process of cancer cells growing out of control. And so I'll throw a bunch of bouncy balls in. Kids aren't able to keep up with it, and I will help relate it to what their peer has gone through with the tumor inside of their body also becoming chaotic and cells firing rapidly and growing out of control. So I just wanted to share a great case study and how impactful these presentations can be. So a couple years ago, I worked with a patient who we'll call Samantha. So she was an 8-year-old that was diagnosed with acute lymphoblastic leukemia, and she'd done really well with treatment overall. She had spent quite a bit of time in the hospital, but generally coped well. So about a year into her treatment, she was medically cleared to return to school. But unexpectedly, she was extremely apprehensive to going back. Just even talking about it was triggering for her. She was just really worried about going back because kids would ask a lot of questions of her. She hadn't even been to third grade yet that year, and she was just so worried about being bombarded with "Where have you been?" and "Why is your hair short?" and other questions that would be really tough for her to answer. So this apprehension was also shared by her mom, who didn't want to be the bad guy to force her sister or to force her daughter back into the school setting, and was fearful that Samantha would be traumatized by her extreme nervousness in going back that first day. So despite Samantha having been supported in multiple ways by a lot of different personnel, she really wasn't budging, and she was refusing to return until we introduced the concept of me coming to her school to talk to the class. And then she completely pivoted, because of the close nature of our relationship and how I've supported her over so many months. She then started to express excitement for the first time in going back. So once a return date was then set, and once the logistics of my visit were worked out with the school administration, I then worked with the family and her teacher to highlight specific things that should be addressed. And a prominent feature of this reentry plan and any reentry plan is to give the patient control. So we gave Samantha control on a lot of aspects, like if she wanted to be present, if she wanted her mom there, and what props to include to help educate the class about her leukemia. So I'd say that this presentation was a perfect example of how successful these talks can be for both empowering the family and the school staff. And it really kind of, brings a huge burden off of the school as these talks can be really difficult for teachers to have. And When these talks occur, teachers can then later on address any misconceptions that didn't get addressed in the moment. And they can take emotional stock in other children's relationships to not just cancer, but the experience of going to the hospital as well. So how do we incorporate both play and learning to support the whole class of a young child who is undergoing cancer treatment? So I think it's easy for a lot of us to forget that play and learning are inextricably linked during early childhood. Classrooms that base their curriculum on an understanding of this will have learners that thrive both academically and socially. And there's no better opportunity to implement this philosophy than when a child with something like cancer is returning to school. The stability of the school environment is the perfect place for any child to learn. And as many of you can attest personally from your experience of teaching during the pandemic, virtual learning just doesn't cut it and provide the same hands-on opportunities for academic and social growth. So when kids with cancer are learning in person, teachers have the capability to assist them in scaffolding and other skills, either during formal learning modules or during more free-flowing, purposeful play sessions where play is embedded into the curriculum. So unfortunately, trends in education, as probably many of you know, have led to a drop in teachers promoting purposeful play and free play over the past 30 years. And at the turn of the 20th century, schools became a lot more focused on rigorous, skills-based curriculum that neglected play as a means to learning in schools. Experts cite the No Child Left Behind Act of 2001 as a real turning point with this, with kids moving away from play opportunities. So this movement away from play also coincided with greater expectations for kids entering grade school. Now, even kindergartners in districts around the country are expected to possess a greater degree of introduction of phonics than ever before, and then play will go on the back burner. So also with this, technology and its pervasiveness in education has made it much more difficult for many teachers to get back to basics and using traditional play as a tool to learning. A middle ground between formal learning that is curriculum-based and lessons guided by purposeful play can create an ideal learning environment. So I just kind of want to highlight some ways that you guys can normalize medical care in the classroom. And I utilize these 3 activities pretty consistently in my therapeutic activities that I'll engage in with patients. So some of you guys have probably heard of the concept of loose parts, that it can really be utilized anywhere with young children. So for those of you that aren't familiar with this style of play, it's basically just providing a variety of different unrelated materials with no preset rules on what to design with those materials. Really only simple prompts are provided by an educator to follow a theme. So themes that I'll employ, obviously have to do with some component of the hospital. So it can be a great STEM-based play activity to challenge kids to think about healthcare concepts like anatomy, body processes, and medical equipment. So secondly, teddy bear clinics are conducted by nearly every child life department in hospitals around the country. So patients will use their own stuffed animal or teddy bear and are provided one by staff. And you kind of go around to different stations that emulate the hospital of experience. So there's a station set up to give your teddy bear an IV, one to admit your teddy bear to the hospital, one to go to surgery, one to get an MRI. So it's a child-directed, yet we provide basic teaching about the hospital. Child-directed type of play, but we're providing basic teaching about the hospital as well. So this can be easily adapted to fit a classroom setting. In any structured play, maybe any structured play you're engaging in can be something as simple as going to the doctor or helping your bear with an injury. And finally, calm down kits, which maybe many of you have utilized in your classroom. So they're just a mechanism to help kids cope in the hospital. So kids are designing these calm down kits with different items that they're to utilize when they get angry, sad, stressed. So things like a pinwheel, bubbles, stress ball, or other sensory items that are used to help kids cope in a given situation. So I urge any educators tuning in today to utilize games like this or activities just to provide basic education on the human body, childhood illness, and how to just cope in general with stressful events. Notably dealing with going to the doctor or hospital. So in addition, there's some common games that I play consistently with kids in the hospital that can also be tailored to the classroom setting. So hospital-based bingo is utilized often in child life departments around the country. So there's plenty of templates that can be printed online. So if there's any classrooms that play bingo out there, it can be you can pivot to doing a hospital theme one. It's really fun to do, and it'll just kind of spur a conversation about going to the hospital and being sick, and may even be used to address a classmate's return after cancer treatment. So all kids love scavenger hunts. They're always fun to do. So a hospital-based scavenger hunt where different pictures are printed and then hit around the classroom that have to do with the hospital or going to the doctor will be another great way, fun way for a conversation to be started. And a lot of times I'll kind of retrofit a board game. So an example here is memory. So every kid has played memory before. So a lot of times I will make a hospital themed memory that will then be used, played, and then used to just kind of spur a conversation about, oh, this is a mask that, we all wore during COVID, but we also wear in the hospital. Oh, this is a stethoscope. I saw that when I went to the doctor. I saw that when I went to the hospital. And we'll just get kids talking about going to the hospital, and we'll help normalize their own healthcare. So, and finally, just some take-home points today to remember as you all leave this, hoping to help support any child or sibling impacted by pediatric cancer. We want you guys to utilize resources, both local and national, that exist to educate children on pediatric cancer. We want you to rely on support from school personnel to manage the absence within your school and classroom. Use both free play and purposeful activity to promote the understanding of medicine. We want you to incorporate activities that promote healthy coping and help children become cognizant of their support structures in place. And lastly, advocating for curriculum that further educates on the hospital experience. I just wanted to end on a quote today from the awesome Fred Rogers, who also in his day did a lot of great work on his show in educating kids on illness and going to the hospital. So he says, play is often talked about as if it were a relief from serious learning, but for children, play is serious learning. Play is really the work of childhood. And then one more thing, on the bottom of this slide, I've included a QR code at the bottom right that will link to a website from Ask. It's their educational toolkit, which has a ton of great resources for educators to make the back to school transition successful. So it's there for any of you that haven't linked to it yet.
Thanks, Joe. That was such a great wealth of information, and you really painted a picture of what it's like for children when they're in the hospital and clinic and going through treatment from more of the hands-on, not just the medical side. We have a couple questions. The first is, what's the best kind of play in school and at home to help with trauma healing?
I would say play that, is a combination of being both individualized and in group settings. So I hope that every educator or school staff tuning in today has great resources out there and great personnel working in the school. So school psychologists or somebody else that has a background in play therapy, I think would be especially helpful. So I mentioned it at the very beginning of my talk. So play therapy is incredible. It's a separate discipline from what I do. And there's a lot of psychotherapists or other counselors that have a background in it. So I would advocate as best you can to get somebody with a play therapy background that works at your school. But educators in general that are having these purposeful play sessions or free play sessions, just ask some of the kind of the prompting questions. I think like some of the ones that I outlined that I use to get kids talking about trauma or being in the hospital, just kind of asking very broad, general questions in a non-threatening way, I think is a great way to get kids to open up about the hospital and their experience in their cancer journey.
And then one last question. Teens can be very open to child stuff, but how does Child Life approach them since they are really young adults or on their way to being young adults?
Yeah, so unfortunately, I wanted to include a lot about teenagers in this presentation, but I tended to focus more on younger kids, younger school age kids. the approach with teens is very different, obviously, from how you're going to approach things with younger kids. How I support teens is I tend to kind of more talk to them, obviously, as kind of I would talk to a young adult, because I think that a lot of teens that are in the hospital for cancer or they can feel infantilized and they can feel like so much autonomy has been taken away. And talk about regression, I think it's so evident for teenagers because they're in this children's hospital, which children's hospitals, they're designed mostly to help younger kids heal, and there's not a lot of spaces and resources for teenagers. um, so I think the hospitals are getting better with that, but I think to support teenagers, just advocating for those developmentally appropriate tools and resources to help them cope, whether it's video games, more psychologists that work in the hospital to help them cope. There can be a variety of different things to